Hello everyone, welcome to Psoriasis 101. We're going to talk everything today. If you have a lot of psoriasis, a little psoriasis, today is for you because we're going to talk about psoriasis. What is it? What are the types of psoriasis? What are the risk factors and what triggers a flare? What is the big picture? Because psoriasis affects more than just the skin. And finally, the treatment options, everything from what you can do yourself to prescriptions to phototherapy. And who are we? We're Noted Dermatology. I am your personal board-certified dermatologist. I am here to tutor you about the skin. Please visit noteddermatology.com. We have a lot of information. Everything's educational, non-biased. Neutrogena does not care who I am. I do have a Neutrogena rep who comes to the office, but they always come at noon is when I'm eating. So I always tell the front desk to tell her that I'm not there, but sometimes she sees me microwaving my leftovers, so that's my only connection to the industry. Visit us at noteddermatology.com. Okay, so about psoriasis. Psoriasis is a chronic inflammatory condition that affects 2% of the population, and it normally pops up when you're in your 30s or when you're in your 60s. For psoriasis, I always think of the number 2 because it's 2% of the population, and it pops up in 2 different points of life. It's unpredictable. Some people have psoriasis all the time, all year round, no matter what. Some people, their psoriasis pops up only in the winter or if they're really stressed out. It's very personalized. It's not curable, but it is controllable. There are so many injectable medications that can completely eliminate psoriasis. We've come a really long way in the past 20 years. So as far as, these are our notes that we're taking. These are what I think is the most important for a patient to know about psoriasis. For this section, psoriasis is not curable, but it is controllable. A little quiz. Don't worry, these quizzes are going to be so stupid because I have PTSD from the 150 years that I went to school. So our fun little question today is, which celebrity has psoriasis? And if you answered,
but it's psoriasis.
Psoriasis? I cannot have psoriasis.
If you have psoriasis, you and Kim Kardashian have so much in common. I'm so jealous. So what is psoriasis? Normally in the skin, for a skin cell to get from the very bottom to the very top of the epidermis, that process takes 28 days. In psoriasis, for unknown reason, this process only takes 4 to 6 days. This causes skin cells to be very immature. This causes a lot of inflammation. And to accommodate all of those inflammatory cells, our blood vessels get very wide in diameter. It delivers all this blood to the skin cells on the surface. The skin is very red and thick. It can be very itchy, painful. It can bleed easily. The skin cells are very immature, so they cannot slough off properly into the air. So you get a buildup of these dead skin cells, which we call flakes or scale. In terms of getting rid of psoriasis, there are 2 steps. The first step is to get rid of the scale or descale it. For this, we usually use salicylic acid, urea, something like that. So the scale is gone. Now we have to reduce the inflammation. Reducing the inflammation, if you come to us in dermatology, we usually prescribe topical steroids to reduce that. The skin goes back to normal and your blood vessels eventually shrink down back to their normal level, and then your skin looks beautiful again. Moving on to the types of psoriasis. What we see most commonly in clinic is plaque psoriasis that affects the elbows, the knees, the scalp. The next type of psoriasis is gut taste psoriasis. It classically happens after somebody gets a strep throat infection. I had a patient the other week who was just feeling really run down for a week or so, and then a few weeks later he popped up with gut taste psoriasis. And there's these little, we call them gut tape marks, or like little tiny drops of psoriasis. This patient in the stock photo probably scratched his back, and this resulted in what we call the Koebner phenomenon, which is when psoriasis appears in places of injury. Moving on to inverse psoriasis, this affects the folds of the skin, so like armpits, groin, under the breasts for women. This type of psoriasis does not have scale, so you don't need to descale it. This picture here in particular is a very good example of how shiny, that's my dog, her name's Bee. She wants something. This is a really good example of the type of shininess that's involved in inverse psoriasis, which is a clue as to the diagnosis. Next is nail psoriasis, very common but very difficult to treat. And lastly, some patients only get scalp psoriasis. It's often on the back. It can go into the forehead and also behind the ears, really common. Here's who you just heard. Her name is Bee. She is perfect. She's never done anything wrong in her entire life, and look at her run. She does such a good job. Anywho, B's favorite thing to talk about are risk factors and triggers of psoriasis, the most important being your genetics. Secondly, a big factor is smoking. I find oftentimes I'll walk into a patient room with psoriasis and the first thing I can smell is smoke. So it's very, very important to try to quit. I know it's tough. I tried to quit Diet Coke so many times. It's impossible. I understand. Also, alcohol is associated with psoriasis as well as obesity, stress, certain medications like beta blockers, certain infections like strep that we talked about before, injury, the Koebner phenomenon. We are already experts on the Koebner phenomenon. Sunburn, this kind of relates to skin injury as well, and also winter can be a trigger too. The takeaway for this section is try to reduce your exposure to triggers. Moving on to the big picture, psoriasis can affect the entire body. Oftentimes people think of psoriasis as a skin disorder, but it can also create systemic inflammation that can affect many different organs in the body. For example, if you have psoriasis, you have an increased risk of heart disease like cardiovascular disease or atherosclerosis, also liver disease, diabetes, lung conditions like COPD and sleep apnea. Also, your joints can be affected with psoriatic arthritis. You may have an increased risk of osteoporosis. You can have inflammation in the eye. The GI tract can be affected as well. You have an increased risk of inflammatory bowel disease, which is Crohn's or ulcerative colitis, an increased risk of cancer such as lymphoma. Also, your muscles can be more likely to get fibromyalgia, erectile dysfunction as well. I didn't know what tasteful stock footage to use, so I just put these pills, these blue pills, and mental health as well. You have an increased risk of depression, suicidal thoughts, and social isolation too. So it's very important to keep up not only with your dermatologist and your skin checks, but also keep up with your primary care appointments because we have to keep even extra special eyes on you to make sure that nothing happens because of the systemic inflammation from your psoriasis. So the big takeaway from this section is psoriasis can cause systemic inflammation that affects other organs, and just keep up with your health and take care of yourself. Let's move on to treatment. This is a bird's eye view of the treatment that we normally use for psoriasis. First things first, we'll go over what everybody should do, which includes lifestyle optimization and optimizing your over-the-counter products. Next, we'll move on to the prescriptions you get for mild psoriasis. Mild psoriasis is considered less than 3% of your body surface area. 1% of your body surface area is your palm, including your fingers. So if you have 3 palms or less of psoriasis, that's considered mild. Lastly, we'll go over prescriptions for severe psoriasis. Severe is considered if you have more than 10% or if it's causing some kind of functional or emotional impairment in your life. For example, maybe you don't have so much psoriasis, but it's right in your groin and it's very difficult to walk, then that could be considered severe. Or if you have itch that just won't stop. Lifestyle. Because we are experts in psoriasis affecting the entire body, we know we have to change our lifestyle to decrease the total amount of inflammation caused by the psoriasis. We should not smoke, drink too much, and we should also maintain a healthy weight. Just eat a healthy diet in general. Exercise, vitamin D supplements have shown to be helpful. Things on the maybe list are probiotics, omega-3 fatty acid supplements, and vitamin B3, which is niacinamide. Moving on to over-the-counter treatment. So this is where patients get tripped up and can be confusing, so let's walk through it together. Psoriasis consists of 2 parts, the scale and the inflammation. We treat these both separately. First, for scale, we have to get the scale off and, we call descale it with things like salicylic acid, glycolic acid, sulfur, or oils. To decrease the inflammation, this is where we use plain moisturizers like even just plain Vaseline, along with the topical steroids that we prescribe in clinic. There are a few ingredients that do double duty, and those include urea, lactic acid, and coal tar. For the scalp, to descale the flakes there, we often use salicylic acid shampoos or just putting oil in the scalp, leave it in overnight, and then rinse it off in the morning. To reduce inflammation in the scalp, we often use anti-dandruff shampoos because many of them are anti-inflammatory as well. And also, when you have really inflamed skin, it's easy for yeast to start growing in there, so it's also beneficial to use an anti-dandruff shampoo. As far as what does both for the scalp, coal tar shampoo, not so common in the store, but you can buy it on Amazon. Next, to treat just regular skin with psoriasis, to descale, there's many salicylic acid creams. To reduce inflammation, plain moisturizers, nothing fancy. And to do both, we have lactic acid. Amlactin is something that we recommend all the time in dermatology. Don't worry, I'm not paid by big amlactin to say this. And also urea. Urea products are very, very popular, and they come in a bunch of different concentrations. Things on the face, use more like 5%. Use on the feet, you can use up to like 40%. And speaking of hands and feet, to descale, you can soak it in like a vinegar soak, or you can soak it in Epsom salt to reduce inflammation. Same thing, plain moisturizer. And for both, again, lactic acid and urea. In addition, you can buy an over-the-counter phototherapy device. How this works is it uses ultraviolet light, or specifically UVB, which penetrates very superficially into the epidermis, and that decreases inflammation, which is very helpful for psoriasis. Things like UVA, that's what tanning booths use, that goes too deep. And then visible light, things like a red light mask, that also goes too deep to be helpful for psoriasis. So really UVB, specifically 311 nanometers is what you need to buy. A device like this you can buy online. So the summary for this section is to treat over the counter, you have two different steps, descaling and decreasing inflammation. A few ingredients do both of these steps to make it easy. And moving on to prescriptions for mild psoriasis. Mild psoriasis, the many different types, we treat them all differently. For plaque psoriasis, if you come into the office, we're likely to prescribe topical steroids, possibly also topical vitamin D, which is called castopotrine, or the brand name is Dovanex. Also sometimes topical vitamin A, which is called Tazorac. We also use that for acne as well. And there's newer ones, I don't know how to pronounce these. You will likely leave your dermatologist appointment with a few different topical prescriptions, and if you're unsure what to do, let's go over a sample flare schedule. So let's say you're flared, you have really bad psoriasis, you need relief. Use the topical steroid twice a day, every day for 4 weeks. It's usually 2 to 4 weeks, somewhere around there. Listen to your dermatologist. Let's say you're back to normal. You resume your job as a knee model because your skin is looking so good. In that case, then you can go to using your calcipotriene twice a day. The calcipotriene, it doesn't work as well as a steroid, so it's not as strong, and likely your psoriasis is going to creep back. When it does, at the first sign of it, then you start using your steroid twice a day for a few days until it goes back to normal. Then you book more jobs for your knees because, again, your skin is looking so beautiful. And what is the point of going back and forth? The point is you want to use a steroid as little as possible, because if you overuse a steroid, it can thin the skin. What does thin skin look like? It looks like this. Your epidermis and your dermis are just very thin. I had an old dermatologist who said this was tissue paper skin because it's about as thick as tissue paper. So that's a sample flare schedule. The prescriptions we use for inverse psoriasis, we often use things called non-steroidal alternatives, which are things that are kind of like a steroid, but they're not. We use Elidel Protopic. We use these often in eczema as well. For scalp psoriasis, there's a bunch of options. For steroids, you can use solutions, foams, shampoo, and also calcipotriene comes in liquid form as well. Also, we can prescribe you a ketoconazole 2% shampoo, which is stronger than the Nizoral you can get over the counter. Hand psoriasis, we often use topical steroids. We have to use the strong stuff because the skin of our hands is very thick and we need something strong to be able to penetrate into that skin. So let's say you're using your over-the-counters, you're using your topicals, and it's just not quite enough and you need something a little extra to give you a boost. If you want more, like Brittany wants more, you can use Occlusion. And what is this? This is when you have your psoriasis skin. Directly on top of that, you put topical steroids. Directly on top of that, you put just plain Vaseline, and directly on top of that, you put some kind of plastic wrap. What kind of plastic? For the body, we usually recommend just like saran wrap or food wrap to put it on, and that way the steroid and the Vaseline has absolutely nowhere to go except right into the skin. For the hands, you can use gloves to occlude overnight, and for the feet, you can get these little footsie kind of liners to line the feet overnight. And I would put socks over these so they don't fall off. So, in summary, for mild psoriasis, you try to decrease the amount of topical steroids you're using, but the topical steroids work very well. And Brittany and her friends, they occluded their psoriasis overnight, and they're talking about it. They're having so much fun. Moving on to severe psoriasis. So if you live in the US like I do, you've likely seen these commercials on TV.
Talk to your dermatologist about Skyrizi.
Just ask your doctor about Taltz.
Ask your doctor about Tremfya today.
So what do these injectables do? These block specific inflammatory markers in your immune system. The first one, or one of the earliest ones developed, is called Humira, that was released in 2004, and that blocks a specific inflammatory marker called TNF-alpha. Humira, it works pretty well. It can clear up to 11% of patients with psoriasis, so it works. It's not the best that we have now, but it's an oldie but a goodie. In 2008, Stelara came along. That's an injection every 2 months. You still have blood work to do, but about half of patients clear on Stelara. Next came Cosentyx 2005, an injection once a month. You still have to have blood work, and 40% of patients clear completely. The most recent one is called Skyrizi, that was released in 2019. That's an injection just 4 times a year. There is no blood work involved, and almost half of patients clear completely. So as time goes on, the injections have been getting better and better, and they have more specific targets that cause less immunosuppression, making them safer and less immunosuppressive, so you don't have to worry about things like getting a sore throat, getting infections, things like that. In terms of injectables, patients are almost always scared of starting the injectables, but really they're very easy. You inject normally in the belly or on the thighs. You use an alcohol prep pad. They make the injections very easy. It involves a button. You never see a needle. Anybody can do it. It's really very easy. So what about pills? Maybe you've seen this commercial for Otezla.
Otezla is the #1 prescribed pill to treat plaque psoriasis.
And what is Otezla doing? It is blocking the formation of these inflammatory markers. Only 3% of patients clear on Otezla. It's not that great, but it's a good add-on if topicals aren't quite enough, but you're not ready to go an injectable medication route. And next, what about light therapy? So phototherapy, we can use UVB, which penetrates very superficially into the skin to decrease inflammation. When you get phototherapy in the office, you come in usually on a Monday, Wednesday, Friday schedule or a Tuesday, Thursday schedule, and you either get naked or you get just down to your undies, and you go into this booth and you get your light treatment. You start off with the light being just like a few seconds long, and then as you come back, we get the light treatment to be a little bit longer and a little bit longer, to the point where it's reducing the inflammation in your skin, but you're not getting burned. Patients actually really enjoy getting their light treatment. It's nice and cozy in there. It also increases your vitamin D levels, so oftentimes patients are a little sad when their psoriasis is gone and they don't come back for phototherapy. For phototherapy, why do you have to come to the dermatologist office like a dork? Why can't you just go to a tanning booth and meet sexy women with a belly ring like this? And the answer is the ultraviolet light that we use. So, like I said, we use ultraviolet B, which is very superficial in its penetration. When you go to a tanning booth, they're using UVA, which penetrates much deeper into the skin, and that causes a lot of risk factors and also increases your aging and risk of skin cancers and things like that. So that's why we like our phototherapy booth. In terms of our Psoriasis 101 notes, severe psoriasis, you have a lot of options. You have injections, you have pills, you have phototherapy. There's a lot of treatment options for psoriasis, so I hope you found this helpful. Thanks so much.